Hi everyone, it's Laura Jordan with Jordan Therapy Services coming to you today with a video about pregnancy loss and specifically miscarriage. So I've been doing videos and blogs and all sorts of material on my Facebook page this month about pregnancy and infant loss because October is Pregnancy and Infant Loss Awareness Month. And so today I wanted to talk a little bit about some normal grieving that might be happening and some things that might be happening differently. You may be experiencing a miscarriage or a pregnancy loss yourself or an infant loss, and just wanted to kind of go through a list of some very normal things that you might be experiencing, just to kind of put your mind at ease that is normal. It's not abnormal by any means. So first up is sleeping. You may experience a change in sleeping patterns. You may be sleeping more. You may be having some insomnia and sleeping less. You may be having some trouble getting to sleep, or maybe you don't have trouble getting to sleep but staying asleep. That's all very normal and should subside with time. Another symptom that you might be experiencing is a change in appetite. And so you may be having a loss of appetite, or you may be eating more than usual. Completely normal. Again, should subside with some time and some processing and kind of working your way through your grieving process. Not that this grief will ever disappear, it will just kind of morph and maybe dissipate just a little bit, or look different rather than dissipating. But it's all very normal. Another thing you might be experiencing is just high emotion and tearfulness, crying from what seems kind of out of nowhere, but completely normal. You may be feeling inclined to isolate yourself. You may be successful in doing that. And so I really want you to pay attention to that and to be careful. It's not abnormal for someone to, especially an introvert, to want to grieve kind of on their own, but that can be kind of a slippery slope, and we want to make sure that we're reaching out for support. Even if it doesn't feel exactly natural, this is kind of an above and beyond situation where you're really going to need and want, on some level, some support around you, and to kind of surround yourself with that love at this difficult time. Irritability is another thing that you may be experiencing. You may be kind of getting angry more readily than what you have before. Again, completely normal. Some things that I want to just kind of round out this video with are ones that are concerns. So if you find that you're wanting to and are increasing maybe alcohol intake or drug intake, whether that's illicit drugs or prescription, whatever the case may be on the lookout for that. And if you're a friend or a partner, part of the support network for someone who has had a pregnancy loss or an infant loss, be on the lookout for that. And if there's an increase in that intaking of substances, they're likely wanting to numb that incredibly intense pain. But unfortunately, in the long term, that's just not going to be as helpful and can actually feed more into depression and anxiety. And last but not least, keep your eye on whether you're maybe avoiding some of these emotions that are very normal after a pregnancy loss or an infant loss, and just kind of carrying on as usual. This is going to require some special attention on your part. And again, if you're part of the support network for someone who's experienced this, just kind of watching for that and kind of monitoring and certainly reaching out for extra help, whether it be from a support group or a trained counselor. That's something that I always encourage, when in doubt, kind of check with a trained professional to see kind of how you're doing and sort of a check-in after this trauma, because certainly this could be the case for you, that this was a trauma. So again, my name is Laura with Jordan Therapy Services, and you can find out more about me on jordantherapyservices.com. And I hope today has been helpful, and I will see you next time. Take care.